When you are doing venipuncture, it's possible that a problem will arise. A large drop of blood may form on the skin as the needle enters the vein. This is because you punctured the vein too slowly, allowing the blood to escape through the lumen, the opening in the tip of the needle. However, it's an indication that you have penetrated the vein. Do not alarm the patient. Simply continue with the procedure. Next time, insert the needle with a more rapid motion.
Blood may fail to enter the tube because the needle is not in the vein, or because the tube has lost its vacuum or is otherwise defective. If the angle of penetration is too shallow, the needle may be above the vein. If you suspect this, try advancing the needle a little. If the angle is too steep, the needle may have pierced through the vein. If you suspect this, try withdrawing the needle a little at a time. If the vein has rolled, the needle may be beside the vein. Do not probe with the needle because this will cause discomfort for the patient. If you suspect a problem with the tube, remove it and place a new tube on the needle. If blood still does not flow, remove the tourniquet and then the needle. You will need to try to perform the venipuncture on the other arm. Blood may stop flowing because a small vein collapses. If the vein is too small for the vacuum method, draw blood using a syringe and pull back very slowly to minimize the suction.
The patient may faint or feel faint. If the patient is having venipuncture for the first time, is nervous, or has a history of fainting, it's best to perform the venipuncture with the patient lying down. If the patient complains of dizziness, blurred vision, sweating, or if the patient suddenly becomes very pale, he or she may be about to faint. The first priority is the patient's safety. Remove the tourniquet and needle immediately and help the patient to lie down to improve the blood flow to the head. Tell the patient to remain in that position for several minutes.
A hematoma or a bruise may form during venipuncture. For example, if you pierce through the vein, the patient will bleed from puncture sites above and below the vein.
If the area around the puncture site starts to swell, blood is probably entering the subcutaneous tissue. Remove the tourniquet, then remove the needle and apply pressure to minimize the amount of bleeding. And remember to always remove the tourniquet before removing the needle to avoid excessive bleeding induced by pressure from the tourniquet. Blood cells may rupture. This is called hemolysis. Handle the blood specimen carefully to avoid hemolysis, because a hemolyzed specimen cannot be tested. Rotate the tubes gently to mix in the additive. Do not shake them vigorously.
The needle should be of adequate gauge. Usually a gauge between 21 and 23 is used.
The smaller the number, the larger the opening. Alcohol can cause hemolysis, so allow the skin to completely dry before inserting the needle. And refrigeration can cause hemolysis, so store the specimens at room temperature.